My first guest is Dr. Jay Talwalkar, an orthopedic surgeon with Baptist Health.
Hi.
Welcome.
Thanks for having me.
All right, shoulder pain. There's a bunch of causes for shoulder pain?
Lots of different causes. Lots of different causes. The most common thing would be a rotator cuff tear, rotator cuff disease, but arthritis and labral tears, other things like that can cause.
Now you mentioned rotator cuff, and I teased it with rotator. First of all, tell us, what is a rotator cuff?
Rotator cuff is in the shoulder, and it's a series of 4 muscles who create a tendon, and that job of the rotator cuff is to squeeze the head of the humerus against the socket. So those little muscles can cause a lot of pain. They're also very important for movement.
So what causes a rotator cuff injury? It's not always trauma.
Not always trauma. Trauma in the younger patient can be the most common cause, but usually overuse, sometimes time, age, those types of things, or a combination really is the #1 cause.
So, like, well, you said younger is trauma. What kind of trauma? Is it a baseball pitcher? Is it a fall?
Usually overhead athletes are the type of people who are susceptible to it. So people who play tennis or play baseball and younger people, but really a fall from a great height or a motor vehicle collision, something that takes quite a bit of force in someone under 40 is usually the cause of a rotator cuff tear in that age population.
Now, in the older people, they get rotator cuff. I call it rotator cuff disease because I really can't put my finger on. They didn't hurt themselves; it just happened.
Right, and the vast majority of the people I see in my practice are people who come in with that kind of history. It's been gradual. They can't put their finger on any pinpoint accident or injury, and it's been slow in development, but it gets to the point where it affects your sleep or your activities of daily living. That's usually at that point when patients usually come and see me.
So what kind of symptoms might, you think maybe I've got a rotator cuff versus an arthritis or something else?
Right. Well, there are several symptoms. The first one I would say is pain. Pain either during the day when you're doing overhead activities, but the #1 thing is pain at night. When people stop sleeping, that's when they get upset and they need to figure out what's causing their pain. Another big symptom of rotator cuff disease is weakness, but probably a lot less common than pain.
Okay, so they're in your office, they're complaining of shoulder pain. How do you make the diagnosis?
Well, the first thing we're going to do is take a really good history. We're going to ask them what they've been doing, what their activities are, what their hobbies are, and usually you're going to get a plain x-ray if you haven't gotten one. That'll usually tell us if it's arthritis and if there could be another cause of your pain. But if that doesn't show it, then we may order a different test.
Such as MRI?
MRI. If most of the people can have MRIs, but if you've got a pacemaker, there's certain things that may limit you. We can get a specialized CAT scan. But MRI is by far the most common and workhorse test to diagnose rotator cuff tears.
So you've got shoulder pain, you end up in your office, you get the test you needed, you've got a rotator disease. How do you treat it?
Most of the rotator cuff tears that we see are going to be treated initially conservatively. So rest, removing the offending activity, anti-inflammatories, physical therapy. Sometimes we use injections. We're going to try those things first because the majority of the time, 80 to 85% of the time, those are going to be effective.
Physical therapy and exercise also?
Physical therapy and exercise, for sure.
Okay, so that doesn't work. Then what?
And then we have to have the discussion. How much does this bother you? Are you willing to take the risk of surgery? You know, any surgery has risks, but at this point, if you have failed A, B, C, and D, we're going to have a conversation about surgery and surgery to repair the torn tendon back to the humerus.
You do that with arthroscopic, or is it an open procedure, or both?
It can be done. There are a number of different ways to do it, but personally I do the procedure arthroscopically because I feel like it's less invasive, it's better on for my patients, and there are some places and things we can do that you can't get to with open procedures. But if your doctor chooses to do it open, that's not wrong. It's a great way to fix these tears.
That's great information. Thanks for coming in and sharing with us.
Well, thanks for having me. Appreciate it.
Now, here is a Baptist Health Talks about sports injuries.
Some of the most common sports medicine injuries we see involve the shoulder, the knee, and the ankle, such as sprains and strains. Really any part of the body could be injured in athletic activity. One of the more common things we see in sports medicine is your weekend warrior. You're a 35-year-old that's out playing soccer and basketball, may tear their Achilles tendon or a meniscus in the knee. Rotator cuff injuries are common as well. So you don't have to be an athlete to see a sports medicine physician. If a patient or athlete has an injury that's not getting better in a couple days, for example, if an athlete can't walk on their extremity or essentially can't play their sport, that would be a reason to seek medical attention. An athlete shouldn't continue when they risk further injury. The most common treatments are what we call RICE, that's rest, ice, compression, and elevation. If a patient doesn't respond to that, we may order physical therapy, medications, sometimes injections. An MRI may be necessary in addition to x-rays, and in some cases surgery. One reason to see a sports medicine provider is that we treat each athlete uniquely to their condition and what their sport is, and age plays a role, what their activity level is. For example, some injuries need surgery right away, some can wait till the end of the season, and some may not need surgery at all. So it helps to see someone familiar with sports medicine.